It's something most people have suffered one time or another, and one that many people dread: a toothache. When people are in pain, they don't know what to do. Obviously, the first thing to do is call your dentist's office. If there's an emergency number for the office, call it. However, even with the fastest trip to the dentist, you still may be in pain for a couple hours. Keep watching for a few tips to follow while you're on the way to the office. Gum infection. If you have swelling and pain around a tooth, but no fever and little to no pain on chewing, you may simply have an infection in your gum. Start with flossing gently to remove any food particles that could be irritating your gums. Then rinse your mouth thoroughly with warm salt water. You can also soothe irritated gums with aloe vera. Massage aloe juice on your gums with a clean finger for 1 to 2 minutes. Then rinse with warm water. Warm and cold compresses held up to your face next to the swollen gums can also help. Start with a warm, moist compress for 5 minutes. Then follow with a cold compress held against the face until it starts to feel numb. Repeat this cycle 2 or 3 times. If the pain returns, you can go through this cycle again. An antiseptic mouth rinse also can help. Ask your pharmacist to recommend one for you. If you can't do this, mix hydrogen peroxide, 3%, with an equal part of water. Swish through your mouth and teeth for 30 seconds, then rinse thoroughly. Tooth infection. If you have an infection in your tooth or jawbone, you might have a fever, and there would be a swelling in the gum or in the jaw over the root of the tooth. It's likely to hurt when you chew. Your breath may be bad, and you may have a sour taste in your mouth. You may notice pus draining into your mouth. In this case, your only remedy is an over-the-counter pain reliever and arriving in your dentist chair on an emergency basis. Look for ibuprofen or acetaminophen unless there's any allergy or sensitivity to these pain relievers. Preventing toothaches. With the right care, it's possible to go your whole life without a toothache. Brush your teeth twice a day with a soft toothbrush. Focus on brushing gently for 2 full minutes, not forgetting the teeth all the way in the back of your mouth. Floss every day. This is important, but many people don't make the time for it. If you have a bridge or two, flossing under your bridge with floss threaders will help your bridge last longer and extract food particles that might irritate or infect your gums. See your dentist regularly. If you follow his or her treatment advice, you'll be able to handle any problems while they are small. In most cases, it's a problem that has been developing for quite a while that turns into a toothache. When you realize you have a toothache, call your dentist immediately and ask them to squeeze you into their schedule. This is by far the best solution to any tooth, gum, or mouth pain. At Star Bright Dental, a dental office located in the Rockville, North Bethesda area, we make a point to be responsive and available even late at night. We know that toothaches don't always occur during business hours. Call the emergency office cell phone 301-377-2186 and let us know what trouble you're having. We'll help guide you through the process and get you seen as quickly as possible. If you enjoyed this video, be sure to like, comment, and subscribe.